Hello, and welcome to my Fireside chat series. In this series, I'm going to be talking about Vitas. I'm going to be looking at various professional Vitas of professionals who are working in the family courts to see who these people are. It's uh, pursuant to my obligations under Standard 1.05 to take additional action appropriate to the situation when there's potentially ethical violations by other psychologists. And one of the problems, uh, principal problems in the family courts is the absence of competence. That the professionals over here are not even at the level of the APA ethics code, and that is baseline. APA ethical standards is bottom. Above that is expertise and knowledge and acquiring knowledge, but basic competence is required under Standard 2.04. And with the pathology in the family courts, it's an attachment pathology. So you need to have a competence in attachment system that comes from early childhood mental health typically, because that's where you get trained in the attachment system, how it develops and how it works. And if you don't have early childhood background, you typically don't have background in attachment pathology. It's a shared persecutory delusion. So it's a delusional thought disorder in the family courts. So that requires competence in the diagnostic assessment of delusional thought disorders. Typically, you get that out of schizophrenia, but nobody else actually works with delusional thought disorders, a little bit on personality, a little bit of maybe um, bipolar disorder. But most of the time, that knowledge for assessing delusional thought disorders is over in schizophrenia. It's a family systems pathology, and so we need competence in family systems, how families function. That's Mnuchin, Bowen, Haley, Madonis, and Satir, and others in the family systems. And so those are the domains of competence that are required. And the professional vita is where you demonstrate your background, education, um, training, and experience in the various domains required for competence. So if we're working with eating disorders, we would expect to see a vita that has background that shows the training and education in diagnostic assessment and treating of eating disorders. So over here in the family courts, though, the licensing boards have allowed the professional standards of practice to descend into absolutely nothing. They're not even at the level of the APA ethics code. And so that creates a lot of problems for the family courts because they're not getting competent input that they need to make the decisions regarding the child, and that's presenting problems for the parent because many times these incompetent professionals are participating in the delusion and participating in the psychological child abuse because of their ignorance and incompetence. So, and then the final reason for presenting a Vita series is to assist attorneys in the family courts with their cross-examination and mental health testimony. So this will be educating the attorneys in the family courts about how to read a professional Vita. Now, I'm going to try to maintain or not provide much um, personal commentary, much opinion uh, from my perspective regarding the quality of the Vitas that I'm reviewing. I will allow the Vitas just to simply speak for themselves. These are who these people are based on their background, education, training, and experience. I'm going to start with Jean Mercer. She's has a PhD degree in experimental or general psychology. She doesn't report. It's not clinical psychology, but from I think it's 1968 that she got her PhD in psychology. She served as a professor for a number of years at a small college back east. Then she retired in the early 2000s, and now she's presenting herself as an expert in attachment and an expert in family court pathology, and is opining considerably about the diagnostic assessment and treatment of the pathology in the family courts. So that's an interesting category of people who come to the family courts because we don't find that similar category with ADHD or autism. We don't find stray people coming in claiming to be experts in the pathology. But here in the family courts, we get a lot of other people who are not actually involved, who have opinions and want to influence judgments that are occurring in custody cases, which I believe is inappropriate. They're not involved and they don't have the background training on that. So let's start by looking at Jean Mercer and find out who she is. So this is from her blog. I got her Vita off of her blog. And so this is who she says she is. This is what she presents to the general public and the court. So starting with her education, that's where she begins. And she indicates her education is out of Mount Holyoke College from 1959 to 1961. Now, my first comment that you can see is in red is that's an awful long time ago. The 1960s, that's 60 years ago that she received her last or her education in psychology. And what updates has she had since then? What sort of training or background does she have since 1968? Because there's been a lot of information coming since that point in time. Then she got an AB degree in 63 from Occidental College and her doctorate from Brandeis University in 1968. Now, I graduated high school in 1972. Dr. Mercer graduated her doctorate degree in 1968, 4 years prior to my graduating high school. Look at me, I'm an old guy. So that's another feature of Dr. Mercer's Vita is that she's been retired from her teaching for a number of years. And I would suggest that she more fully embrace her retirement rather than trying to become an active force in resolving issues in the family courts relative to this education. But that's the entirety of her education. Okay, so when you look at Standard 2.01, boundaries of competence based on your education, training, and experience, here's her education, 1968. So then the next place she goes to is her employment, which is standard on a Vita. A Vita will start with your presentation of your education, typically, and then it will move into your employment and then into publications, if that's your domain, or other activities, other professional activities, but education and employment. So let's see where she's worked. This is her experience. So she started as an assistant professor, Wheaton College, 67 to 69. So right after she graduated, got her Ph.D., she got an assistant professor position at Wheaton College. Then she got an assistant professor position over at State University or State College, University College in Buffalo from 69 to 71. So again, that's what, 40, 30, 50 years ago. She was an assistant professor right after graduating. And that's typical for people who want to be on the academic track. You get your doctorate degree in experimental or general psychology. Notice it's not a doctorate degree in clinical psychology. She didn't list what it is. Let's go back for a second to her education. She didn't list what her doctorate degree is in. She just said PhD in psychology, but it's not clinical psychology. And that's a specific training program for clinical psychologists, the ones who assess, diagnose, and treat pathology. And then we have to get internships and postdocs based on our clinical psychology degree. She's got a degree in psychology, so it's general ed psychology or experimental psychology. So she's not trained in assessment, diagnosis, or treatment of anything, but based on her education 50 years ago. And so then she went out and got positions at teaching, which was consistent with an experimental psychologist. Then she landed her primary position at Stockton College in 74 to 77. So mid 70s, just as I'm graduating from high school, she's gets a college teaching position at Stockton College and remained there the rest of her career. Now, this is an interesting aspect of the Vita. So rather than just saying that she got a professor position at Stockton College or was teaching at Stockton College, that would present kind of a sparse education and work history. If she's just got that as her education and then 3 entries or as her work, that looks kind of empty. She hasn't worked very many places. She hasn't worked with ADHD. She hasn't worked with anything except like teaching general education courses at a small college back on the East Coast. But she kind of expands her work to make it look like she's had multiple work positions when actually it's just assistant professor. Then she moved up to associate professor, then professor of psychologist, and then professor emeritus. Is that how you pronounce it? It's basically a retired professor. That's the word. Emeritus is for retired. So she's worked at Stockton College and then retired in 2006. So she retired approximately 20 years ago from any sort of active work. And so she's just kind of hanging around, I guess, hanging around the house, wondering what she's going to do now for the last 20 years. And she's apparently found herself an interest, which is the family court custody conflict and somehow attachment pathology. That she sees herself as an expert in that. So there's her entirety of her education and employment. She was educated, got a doctorate degree in experimental psychology 50 years ago, and then worked for 20 years, 30 years as teaching a small college on the East Coast, and then retired. I'm not seeing where she's an expert in attachment pathology and family systems and delusional thought disorders or in family court pathology. That's not evident based on her education and experience. So this is the APA ethics code relative to boundaries of competence. This is required of all psychologists. This is ethical, mandatory. We don't practice outside the boundaries of our competence. And so here we have psychologists provide services, teach, and conduct research with populations and in areas only within the boundaries of their competence based on their education, supervised experience. She hadn't had any supervised experience in any aspect of clinical psychology. She didn't have no education in any aspect of clinical psychology. Consultation, I'm not aware of her seeking consultation. Study, that's probably what she'll say. She's read some books, and so she's studied about clinical psychology. She's studied about the family court. She's studied about attachment because she's read some books. Or professional experience. She has no professional experience in family systems, attachment, delusional thought disorders, family court pathology. So, the APA Ethics Code says what it says, and there's a reason for the APA Ethics Code because practice outside the boundaries of competence will hurt people. And so there's reasons for each one of these ethical standards. And perhaps somebody should ask Dr. Mercer, what is the reason for standard 2.01 of the APA Ethics Code? What happens if standard 2.01 is violated? Mandatory standard 2.01 is violated. So, for example, here's just for comparison, here's my Vita. So I did my supervised training at Children's Hospital of Los Angeles. So I did a year of pre-doctoral supervised training at Children's Hospital. It's an APA accredited internship, which is like a really high standard of that. And my rotations at Children's Hospital is supervised and training in China bifida and early childhood education or early childhood mental health. And I went to CHLA specifically because they had a training program in early childhood mental health run through Dr. Marie Polson, who had a therapeutic preschool at CHLA. And getting early childhood specialization is rare. And so you have to locate, there's only a few places you can go for that. The CHLA was Children's Hospital Los Angeles was one of the locations for training in early childhood mental health. And that's a specific specialization, early childhood, because it involves so much brain development, 0 to 5. You have to know the cognitive systems, emotional systems, language systems, attachment systems, relationship systems, physical sensory motor systems, language systems, everything, all the brain systems, how they each develop individually, but also how they interact to develop at 3 months, 6 months, 9 months, 12 months, 18 months, 24 months, 36 months, 5 years. So all the way through development, you have to know all the neurobiological stuff of how the brain's developing. So it's a lot of knowledge. And so that's why it's a specialty practice. You're not allowed to practice 0 to 5 unless you have early childhood mental health or you're consulting with somebody with early childhood mental health. because it's just a separate kind of child during 0 to 5 than it is from 5 to 12 or into adulthood. So I got that background for a year of supervised training in from CHLA, APA accredited. Then I did 2 years of postdoctoral supervised training, also at Children's Hospital. And I shifted a little bit over to, I still did spina bifida, but I shifted over to another research project they had going on there, cancer, kids with cancer. So I was helping to manage a research project, multi-site research project. I think it was six children's hospitals were all coming together and looking at uh, various aspects of attention deficits in kids who've been treated with chemotherapy. So I was involved with that. I was still doing my work on the spina bifida rotation. And then I had early childhood mental health and ADHD, where my ADHD was my community sort of focus. And then early childhood was my personal focus in developing that specialization. Now, licensure in California only requires 1 year of postdoc supervised. So 1 year pre-doc, 1 year postdoc, and then you're eligible to sit for the licensing exam. But you'll notice my postdoc was 2 years at CHLA. And the reason is because the quality of training at the postdoc at Children's Hospital Los Angeles is so superior that they require 2 years. They said, we need 2 years to train you. And if you're going to come to our training program, you have to give us 2 years. We don't care what the licensing board says. Yes, if you just want to get licensed, go get licensed, get your postdoc hours somewhere else. If you're coming to CHLA, you're coming for the training. You're coming, and we need 2 years to train you. And that's what I did. I'm coming for the training. So I was 2 years of supervised training at CHLA. Now, I do this to note that this is what should be on a clinical psychologist. You should be noting where they received their supervised training. And so again, going back to the APA Ethics Code, supervised experience. So if you're working diagnostically, treatment with a pathology, you have to get supervised experience. And then returning back to Jean Mercer, there's nothing. She never has any supervised experience in the treatment of anything. And her doctoral degree is not in clinical psychology. So she has no education in pathology. It's an assessment, diagnosis, and treatment, not anything, not ADHD, not autism, not generally how to conduct an assessment, not how to make a diagnosis, not any treatment models. So she's not been trained, educated, or trained in any approaches to psychotherapy for anything in her entire life. She got a doctorate degree in experimental or general psychology, and she taught courses in general experimental psychology for 30 years and then retired. So that's a very insubstantial vita for demonstrating any sort of knowledge or competence in the domains that are needed for the family courts. So let's take a look. Next thing she presents is her professional activities. Okay, now, you can present your journal articles or professional activities. But the thing that I would note for parents and for attorneys, family law attorneys, is all these professional activities are fluff. They're nonsense. She got a position with where she's expressing her opinion about things. So, for example, consulting reader infants and young children from 92 to 2000. She has no background in infants or young children. So why is she being a consulting reader to something she knows nothing about? She doesn't have any training in that based on her vita, because she presents herself as having expertise and doing stuff, but nobody actually takes a look to see if that's backed up with her actual experience. And then she's editor of something else, and editor of something else, and vice president infant mental health. She has no training in infant mental health. I'm certified out of Fielding Graduate School in infant mental health. She has no training in infant mental health. What's she talking about infant mental health about? President, New Jersey Association for Infant Mental Health. And so that's the disconnect relative to some of these Vitas. The people will present that they know something to the general public and to the courts, but if you actually go back and look at their Vitas for education and training, they have none. They have opinions, they read books maybe, but there's no substance or foundation to those opinions. So I would just put all of Jean Mercer's professional activities in kind of the fluffy Vita kind of stuff. It's just expansive, but it doesn't show what training she has. She's active in telling people what her opinion is, but I'm not sure I necessarily see what that opinion's based on. So again, let's take a look at my Vita relative to my background. I have parent-infant mental health certification out of Field and Graduate Institute. I know two additional diagnostic systems for early childhood mental health: the DC 0 to 3 diagnostic criteria, which is stronger in diagnosing attachment pathology, and the DMIC diagnostic manual or diagnostic criteria out of Greenspan's group. And that's stronger in diagnosing autism spectrum pathology. So not in addition to the DSM-5, I know two additional early childhood diagnostic systems. You see anything like that on Jean Mercer's Vita? No. She has no training in early childhood mental health, and yet she's serving as president of these organizations about early childhood mental health. I would say that seemingly meets practice beyond the boundaries of competence, but that's just, I'll let somebody else decide on those sorts of things. And then I additionally know two different treatment models for early childhood attachment pathology. So these are standard approaches in early childhood mental health. I'm trained in both of them. So I received training in Watch, Wait, and Wonder out of the University of Toronto. That's for infants. Watch, Wait, and Wonder. How do you do psychotherapy? How do you do attachment therapy with an infant? You can't talk to an infant. You have to work through the mother. And so that's what Watch, Wait, and Wonder is helping the mother understand her stuff. There's basically four ports of entry. You can enter through the child's behavior or through the child's mental representations, or you can intervene through the parent's behavior or the parent's mental representations. No matter where you intervene, it will affect all the others. So if I change how the mother sees her child, that's going to change her behavior, which is going to change how the child sees the mother, which will change the child's behavior, which will change the mother's perception of the child. So no matter where I intervene, I change the child's behavior, changes the mother's representation, changes the mother's behavior, changes the child. And so there's four ports of entry, they're called, and that's Dan Stern on the motherhood constellation. But do you see any background like this over on Jean Mercer's? No. So I know two additional diagnostic approaches, two different diagnostic systems. I know two standard treatments. The other is Circle of Security out of Washington here, and that's for preschoolers. So I know the infant attachment therapies. I know the attachment therapies for preschoolers because I worked children ages 0 to 5 in foster care. So Child Protective Services would remove a child and put 0 to 5 and put them in foster care for whatever reason. Then they would send the children to our clinic for assessment, diagnosis, and treatment. So that's where my background is. And 0 to 5 is spot on the attachment system, and foster care is holy cow the attachment system. So then, that's just by comparison of what. And then professional experience. I was a clinical director for a 3-university assessment and treatment center for early childhood mental health with our referral source through the foster care system. And, if you get 3 universities involved, that's a big event. And if we're getting our referral source is through CPS, and our funding was through the county Department of Mental Health. And so that's a huge county involvement. There were a lot of people putting this thing together, and they hired me as the clinical director. So I was in charge of all the clinical operations of the psychological treatment, as well as the occupational therapy coming out of Loma Linda University and the speech and language coming out of the University of Redlands. And so but they sent faculty. Those two universities sent faculty over, and then trainees, and then Cal State sent hired the clinical staff, but also provided faculty and trainees into the clinic. And I was in charge of the whole thing. So I've had experience diagnosing attachment pathology, diagnosing severe problems in children. Jean Mercer, let's take a look at her publications, because that's the only thing basically we have left. Her education is sparse, her experience is sparse, and her professional activities don't seem to be connected to her experience or education. So let's actually take a look at where her research background, where her substance of her doctorate degree, what does she know? And so if we look back at her research, so she was apparently went under the name of Lester at this time. So it's from 1967. So again, her research is 50 years old, but it's sound localization during labyrinthine stimulation. That's sensory motor, that's perceptual. Then in 68, prism adaptation, that's sensory motor. And then rod and frame test, 1968, published in Perception and Motor Skills. She's a perceptual motor experimental psychologist in the 1960s. She has no experience with attachment, no experience with any pathology ever. She has no experience assessing, diagnosing, treating anything, no education in it, no research in it. She's an experimental psychologist in perceptual motor stuff. And you keep going, rod and frame test, perceptual, auditory, audio gyral illusion, publishing in Perception and Motor. So as far as I can see, and it keeps going, she has one interesting problem with less intelligent students in introductory psychologist classes. This is Lester and Lester. So apparently she published something with her husband at the time, her partner, who because they don't like less intelligent students in their classes or something. I don't know. And then there was another one, Lester and Lester, Fear of Death. I hope something problematic wasn't happening. But again, these are opinion pieces. Okay, these are not research things, and they're certainly not research in attachment pathology or personality pathology or in family court pathology or any relevant research. And then goes back to the perception of polarization in some perceptual test, and then vestibular stimulation. So that's her background. Now I'm totally fine if she wants to, have an opinion about the audio gyral illusion or rod and frame test. Well, that's within her scope of competence. But attachment pathology, family court pathology, narcissistic borderline dark personality pathology, delusional disorders, thought disorders, I'm not seeing any background that would make her competent in those domains. You can look for yourself, show it to me. But then we have 2013, after she retires, then she starts writing about attachment in children and adolescents. And Mercer, holding therapy in Britain. Mercer, holding therapy. So that holding therapy was a real problematic thing. That was like just somebody came up with this idea. And yeah, it got a lot of controversy about that. It was not based in attachment at all. It was just somebody kind of coming up with that. But apparently she got an opinion about that and started going. And you can look more, and she's really locked into parental alienation. It seems, boy, she got locked into that, and she can't adjust out of that. She sees everything, as far as I can tell from her writing. She sees everything within a framework of parental alienation. And I've had to structure her a couple of times saying, I don't agree with those parental, because she keeps wanting to put me with those people and then blast those people and me by association. No, there's no such thing as parental alienation. And I wish Jean Mercer would stop misleading people and lying to people, basically, that I'm part of that group. No, that's a bad thing. We need to all stop using the term parental alienation, including Jean Mercer. She needs to stop using them. We need to get over to real stuff like delusional thought disorders, personality disorders, and family systems. And so, she's now an expert in her mind in attachment pathology and family court pathology. But I'm not seeing that based on her education, training, supervised experience, or professional experience. Her study, she's read some books, but that doesn't qualify her, I think, within the family courts. Let's take a look at mine. This is just one. I have publications, and she bangs me a lot. She hammers me because they're all self-published in my 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 publications are self-published. I did them for a reason. I don't see the reason to pay a publisher money if they're not going to do anything for me. So I self-published. And the other thing it does when I self-publish like that is it baits the pathogen, because that was the argument they used against Gardner, because he had no peer-reviewed research for this new pathology he was making up. But I'm not proposing a new pathology. Oh my goodness, there's so much research around the attachment system, personality disorders, delusional thought disorder. There's so much research over there. And so, but by self-publishing, the pathogen is patterns. So it doesn't actually process information. So it just applies the pattern of criticisms. So it's going to be that there's no peer-reviewed research about Dr. Childress. That's spurious. There's plenty of peer-reviewed research about attachment and family systems and delusional thought disorders. It'll say that no peer-reviewed research. Dr. Childress has some sort of new theory. That's the other one. No, I have no new theory. I apply knowledge. I don't create it. And so if anybody says that Dr. Childress has a new theory, they're just exposing their ignorance. And that Dr. Childress is a pedophile somehow. It's going to be a personal slander against me. That was Dr. Gardner was a pedophile, and it just the pathogen attacks with personal slander as its third approach to pathology, and that's, in my view, what Dr. Mercer is doing with me. She just slanders me for vague reasons and without ever providing any substance to what her criticisms are. Want to take a look. This is a journal article. It came out of my work with Jim Swanson, who's like a top high grand kahuna in ADHD. And that's one of the reasons I went down to work with him. It's UCI Child Development Center is, holy cow, he's one of the best in ADHD. And this was just the article that was generated from my work there. Now you notice I'm fourth article, Childress, or fourth author, Childress C. Leanne Tam was the first author. She was my colleague. She organized, they hired one psychologist to organize the operation of the research or the program, the intervention program. And I was brought on as a clinical psychologist to do the field operations to actually make the thing happen. Leanne Tam was interested in becoming a researcher like Jim Swanson. I was not. I'm a clinical person. I like working with people rather than researching. Then Jim Swanson is number two because he's the Grand High Kahuna. It was his project. Mark Lerner is the medical director at UCI, so he got the third position. I got fourth author position because I ran the project. So you see all those authors beneath that. Those are the people I was kind of supervising and working with in running the project. So everything you read in that article is what I did. Okay, that was my job, was to make that project happen. Then Patterson and Lakes were two postdocs at Children's Hospital of Orange County, who I supervised on this rotation. I supervised them in their autism rotation and in this rotation with Jim Swanson and this project, and then all the other people that worked on the project. Notice it's intervention for preschoolers. So I'm early childhood. I'm doing preschool stuff, but it's ADHD with preschoolers. And notice this is relevant to the family court stuff. Service before diagnosis. And that, we can do that in the family courts. We can provide service before diagnosis, early intervention, it would be called. We can do all of that. I'm trained in exactly this. I've got a big old research article in exactly service before diagnosis. And look, it's in clinical neuroscience research. That's a big journal, clinical neuroscience research. And I'm fourth author in that. And I just generate. I could be producing lots of research if that was my interest. It just wasn't my interest. And I was recruited out of this project. So I was totally fine being in this project, and I'd be generating articles and be moving up in the field of ADHD and preschoolers. But I was recruited out of it for that clinical director position out in San Bernardino County with working with kids in the foster care. So I left this to go work with children in the foster care. Um, so that is sort of the comparison between our Vitas, or between, and here I've got Gene Mercer out there publicly posting on the internet, slamming my professional reputation, saying I don't know anything about attachment, and she does. And I'm just not seeing it. So now I know, because she does a lot of criticism of me on the internet, when opposing counsel is looking for somebody to contradict me, they will locate her sometimes. And I can tell through the cross examination that they've located her. And that is misleading the court. And if any actual family law attorney allows Jean Mercer to qualify as an expert based on her Vita and stuff, you're not doing your job. So this is her Vita. This is how she can be critiqued on it, relative to her competence based on her opinions. Dr. Mercer has not assessed, diagnosed, or treated any pathology ever in her life. She has not been educated to no coursework on the assessment, diagnosis, or treatment of any pathology ever in her life. And she's had no training in the diagnosis or treatment of any pathology ever in her life. And yet she's out here opining on the assessment, diagnosis, and treatment of one of the most difficult pathologies, narcissistic borderline dark personality attachment pathology in the family courts. So that's one of the first people we'll take a look at in the family courts is Dr. Mercer. I put her in that category of sort of random people. It's unclear as to why they have an interest in the family court or what relevance their opinion has to the issues in the family courts. And as we develop standards of practice or reestablish standards of practice in the family courts, one of the first things we're going to have to do is limit this to licensed people, people who are actually have training in clinical psychology, the assessment, diagnosis, and treatment of pathology. Then we're going to look at different levels of that. So we have master's level people, we have doctor's level people, we have psychiatrists, MD level people. And we'll be taking a look at the various Vitas for all of those different kind of categories and professionals that are over here, seeing where they got their background competence in what they're doing. So with that, you can follow me over to the next in line with the Vita series.